Hi everyone, my name is VAISHALI. I have completed Masters in Optometry. Currently I am pursuing Fellowship in Strabismus at Indian Academy of Optometry. Today I am going to demonstrate identification of squint based on direction of deviation, competency, corneal reflex and cover test. Strabismus is nothing but misalignment of eye or deviation of eye. Based on the deviation, it is again classified into esio-deviation, exo-deviation, hyperdeviation and hypodeviation. If the eye is deviated at the outward direction, it is known as exo-deviation. If the eye is deviated towards the inward direction, it is known as esio-deviation. If the eye has any torsional movement and the eye is moved inward in the visual axis, it is known as encyclodeviation. If the eye is rotated towards outward, it is known as excyclodeviation. Based on latency, it is again classified into manifest and latent. Manifest is also called as stropia. It is misalignment of the eye that is visible even when both eyes are open. Latent is also known as phoria. It is also called as hidden squint. It is manifested only when the binocular fusion is disturbed. Based on the competency also we can identify the squint. In competency there is incompetence and concomitance. Incompetence, the deviation or the misalignment will be the same in the all direction of the cases, whereas opposite in concomitance, the deviation of the direction will be varying in the different gaze positions. Corneal reflex. Corneal reflex is also called as Hirschberg test. It is performed using torchlight. For this, we have to shine the torchlight at the nose bridge of the patient and we will see the corneal reflex and the misalignment of the corneal reflex. If the towards nasal side, it is known as exodeviation. If the right reflex is towards temporal side, it is known as esodeviation. If the right reflex is downward side, it is hyper, and if the right reflex is upward, it is hypodeviation. Next, the degree of deviation also we can identify using corneal reflex. If the corneal reflex at the pupillary margin, it is 15 degree of deviation. If the corneal reflex is between pupillary margin and the limbal margin, the degree will be 30 degree of deviation. If it is at the limbal margin, it is 45 degree of deviation. If the corneal reflex at the sclera, then it is 60 degree or more than that. I will explain how the cover test to be done with the patient. Explain how to identify the squint. Now I am going to assess with the patient. So first I am going to see the competency. இந்த சென்டரே பாருங்க. இது எங்கெல்லாம் பொதுவா பார்க்கணும்? தலாசிக்கு. Okay. Now I have evaluated competency. There is no any deviation in the any cases. Next I am going to see the Hirschberg test, corneal reflex test. Okay. Now the corneal reflex is at the center of the pupil, so there is no any deviation in the eye, so the patient is ortho. Next I am going to perform the cover test. That is cover and alternate cover test. Cover test is for we can identify the manifest squint. In alternate cover test we can identify the latent squint, hidden squint. First we have to give the distance target to the patient. Anga 2 therida, the 2 way paranga. There is no any deviation. Now I am going to see the alternate cover test. So there is no hidden squint also. So now I am telling this patient is ortho, there is no any deviation.